The state's Department of Health reporting today an additional 8,935 new cases and a new grim record for deaths in a single day, 120, as well as their highest positivity rate for coronavirus testing in weeks. The nearly daily record-setting surge in Florida triggering long lines of people waiting to be tested and causing officials to question the state's aggressive plan for reopening schools.
At a time when, quite frankly, restaurants have been emptied out, shuttered, it is counterintuitive to mandate students to return to school at full capacity.
Hospitals in hotspots like Florida, Texas, and Arizona, officials say are in danger of being overwhelmed, with personal protective equipment again in short supply. As coronavirus threatens to get more and more out of control, Dr. Fauci recommended taking a dramatic step.
I think any state that is having a serious problem, that state should seriously look at shutting down. It's not for me to say because each state is different.
Dr. Anthony Fauci ending that report from CNN's Martin Savage. To Melbourne now, where 8 out of the 9 public housing tower blocks have come out of hard lockdown and have joined the rest of the city in being in regular lockdown. It means residents are able to leave home if they have to, such as for essential work, study, exercise or shopping. 159 tower residents have now been diagnosed with COVID-19 since Saturday, and at least 53 of them are in the North Melbourne Tower, which will stay in lockdown for another 8 days. Meanwhile, Australia's National Cabinet is meeting today to discuss the pressure the hotel quarantine system is under and may decide to cap the number of international arrivals. The ABC's Melissa Clark has more.
In a time of crisis, Australian expats have had to decide whether to stay abroad or come home. In the last month, 28,000 people arrived in Australia, most of them returning citizens and permanent residents. Alexis Rosenberg is one who decided to stay.
So I moved to Tokyo in 2015 and I've been here ever since.
The lawyer is worried a cap on international flights to Australia could leave her stuck in the event of an emergency.
My mum lives alone in Australia and, it's hard being away at the best of times, but at least I've always felt like I could come home if something happened to her. And the thought that not only flight prices skyrocketing because of these artificial limits, but the fact that we could be on waiting lists or just not able to get flights at all is really scary.
Prime Minister Scott Morrison has previously warned Australians abroad they should return home. But new restrictions on the number of people allowed back into the country are likely. The rapidly spreading outbreak of COVID-19 in Melbourne has seen the Victorian government send all international flights to other states for 2 weeks. New South Wales is limiting international arrivals to 450 people a day, Western Australia aiming for 75 people a day. The issue is both the capacity of the hotel-based quarantine system that has been set up, as well as the capacity of the health system, given international arrivals could bring in more cases at a time when community transmission is growing.
Melissa Clark reporting. The Serbian government has scrapped a plan to impose a weekend coronavirus curfew in Belgrade after 2 nights of protests in the capital. The Prime Minister announced more limited measures, including a ban on gatherings of more than 10 people. The President wanted the curfew due to a rise in infections. Human rights groups accused the authorities of a heavy-handed approach and urged restraint. Thousands of people turned out for a second night of protests, blaming the government for the spike in infections. Former New Zealand Prime Minister Helen Clark was today announced as the co-chair of an independent inquiry into the WHO's response to the COVID-19 pandemic. She told RNZ that review will inevitably assess some of the criticisms the UN body has faced. One of those is over the advice to wear masks, which initially the WHO was reluctant to suggest. However, now it's acknowledged droplets containing the coronavirus can be airborne. The BBC's Imogen Foulkes has more on this.
They're hedging their bets again. I mean, I think it's a difficult thing to actually pronounce on at this 6 months into a brand new virus. I mean, we need to be clear that aerosol transmission of a disease is actually pretty rare. It happens with tuberculosis, it happens with measles, but not much else. And the WHO is still saying that droplets that fall to the ground quite quickly, things that come out when you cough or sneeze, are the primary mode of transmission, but that there is some evidence to suggest that in very enclosed, poorly ventilated, crowded environments, that aerosol transmission might also be a possibility, but that this needs more research. And they have said for a while, wear masks if you're in settings like that and you can't keep the 1 meter distance. I think, as with many other countries, at the beginning of the pandemic, the World Health Organization was reluctant to recommend masks for everybody because there was a huge global shortage, and they wanted to make sure that health workers had them. We have seen how many health workers have died because of this virus, and there was a quiet kind of unsaid, these people have got to be the priority right now.
The BBC's Imogen Folks. As the coronavirus has swept around the world, it's easy to forget how it was at the start of the year, when it first hit Wuhan and then northern Italy. Dr. Stefano Magone is one of the doctors at a hospital in Bergamo. He told the BBC when the pandemic hit, they simply didn't have enough space or enough staff to deal with the sickest patients.
Many of us did not realize the burden we were facing, and there were delays in reacting, closing down the country of the region. So many questions without answers for me and for other people, even now after all these months. What I realized is that there were many delays in reactions at the national level, at the regional level. We made many mistakes. And from our point of view as physicians, we changed the way of taking care of these patients. So we changed the therapies many times because it was a completely new disease.
Dr. Stefano Magone. And today, for the first time in 137 days, there are no more COVID-positive patients on the intensive care wards in Bergamo. Nearly 2 decades after The Office and David Brent first graced television screens, Ricky Gervais says he believes risky comedy is dead. His mockumentary series about life at a paper company in Slough in the UK is considered to be one of Britain's greatest comedies, with his character setting the gold standard for bad managers. Mr. Gervais told The Times Radio he thinks broadcasters now are too afraid to take risks, and he doubts the show would be made today.
I think now it would suffer because people take things literally. There's these outrage mobs who take things out of context and put it on there. This was a show about everything. It was about difference. It was about sex, race, all the things that people fear to even be discussed or talked about now in case they say the wrong thing and they're cancelled. And the BBC have got more and more careful. People just want to keep their job. So people would worry about some of the subjects and some of the jokes, even though they were, clearly ironic, and we were laughing at this buffoon being uncomfortable around difference. I think if this was put out now, I think that some people have lost that sense of irony and context.
That's Ricky Gervais speaking to The Times Radio. Facebook has removed dozens of what it says are fake social media accounts linked to the offices of the Brazilian president, Jair Bolsonaro, and his sons. The accounts were used to target journalists and political opponents of the president, and also discussed the country's response to the coronavirus. Mr. Bolsonaro criticised Facebook for what he called an unwarranted persecution, adding that no hate postings were to be found on his account. Earlier in the week, the president tested positive for COVID-19. The French President Emmanuel Macron says the spire of the Notre Dame Cathedral, which was destroyed in a huge fire last year, should be replaced with an identical structure. His decision puts to an end the speculation that the roof and spire would be rebuilt in a new design. And that is World Watch for today. Back to you, Mani.
Thanks, Annabelle, and that's Midday Report, Te Purongo o Te Paututanga for today, Friday, July the 10th. You can listen back to all of our interviews and our business, sport and rural news at our website, rnz.co.nz/Midday Report. Afternoons with Jessie Mulligan is next, and we'll be back on Monday with interviews and the latest news from Aotearoa and the world. But for now, kia tau, te mauri.
RNZ News at 1 o'clock, I'm Paul Brennan. A man in his 50s who absconded from a Hamilton-managed isolation facility is in police custody and due to appear in court later today. The head of managed isolation, Air Commodore Darren Webb, says the man tested negative on his Day 3 test and has today had his second test. He arrived from Sydney on July the 1st. He says initial information suggests the man cut through fence ties at the 1.8-metre fence to break out of the facility last night at about 6:30 and returned sometime after that. It's believed the man visited a liquor store on Te Rapa Road, which is being cleaned. Meanwhile, security has been bolstered at hotels being used for managed isolation after a person with COVID-19 managed to escape earlier this week. Police officers are now stationed on site, joining security guards, Defence Force and aviation security staff. Kate Pereira Garcia reports.
2-metre-high fences have been put up around the hotels and all of their entrance points. These are in addition to lower fences that keep members of the public at least 2 metres away from anyone in managed isolation. The police say they now have officers stationed at each of the 28 hotels being used to quarantine new arrivals. However, they do not appear to be stationed outside at all times and may be elsewhere on the premises. Ko Kate Pereira Garcia aho.
The former National Party president, Michelle Bogue, who's resigned from the National Party after admitting to leaking confidential information about COVID patients, has stood down from another charitable trust. Ms Bogue passed on to National MPs the names of COVID patients to which she was privy through her role at the Auckland Rescue Helicopter Trust. The Simplicity Charitable Trust has today also accepted her resignation as a trustee. Its chairman, Peter Nielsen, has told Midday Report that he accepted her resignation with reluctance.
In fact, her background and knowledge of the charitable sector in New Zealand and her work was exemplary, and there was never any occasion or never an opportunity in reality to act in anything other than an ethical way.
Peter Nielsen from the Simplicity Charitable Trust. A new study shows that the coronavirus can cross from the placenta to the fetus in pregnant women. A study by the University of Milan of 31 women infected with the virus late in pregnancy found 2 gave birth to babies who returned positive tests at birth. The development of neither baby was affected by their mothers being infected. The government's finances are still deeply in deficit but are tracking better than forecast. Official figures show a deficit of $16 billion. The 11 months ended in May.
Good afternoon. I'd like to start today with an acknowledgement of the Right Honourable Helen Clark being appointed to co-lead the World Health Organisation's Independent Panel for Pandemic Preparedness and Response. The appointment, I think, acknowledges the depths of Helen's experience and leadership. It does represent a significant acknowledgement by the global community. I'm sure she'll do a thorough job and do New Zealand proud. Today, there are 2 new cases of COVID-19 to report in managed isolation facilities in New Zealand. It's been 70 days since the last case of COVID-19 that was acquired locally from an unknown source in the community. The first case is a man in his 20s who arrived in New Zealand on the 28th of June from India. He has been at the Sudima Auckland Airport facility since his arrival. He tested negative on day 3 of his stay, but subsequently tested positive on his test around day 12. The second case is a man in his 20s who arrived in New Zealand on the 27th of June from England. He's been in managed isolation at the Sudima Lake Resort in Rotorua. He tested positive on the 9th of July on the day 12 of his stay there. These cases bring our total number of confirmed cases to 1,192, which is the number that gets reported to the World Health Organization. There are 3 cases considered to have recovered from COVID-19, which means our total number of active cases is 23. There is no one in New Zealand receiving hospital-level care as a result of COVID-19. Yesterday, the labs completed 2,575 tests. That brings the total number of tests completed to date to 424,719. And I am advised and reassured that these numbers will continue to increase over coming days. I'd like to make a few words on managed isolation absconders. There's been interest in the contact tracing and health advice around the 2 absconders from managed isolation facilities in Auckland and in Hamilton. In these situations, health officials, along with the New Zealand Police, undertake investigations surrounding the incident, by interviewing the people and using mechanisms such as CCTV footage, cell phone movements and bank transactions in order to get as clear a picture as possible of the events. Alongside this, health officials will also be in contact with businesses where these people may have visited. In the instance in Auckland, I'm aware that communications did occur between the supermarket and health officials the morning following the incident, with police having had contact during the evening of the incident. However, I have asked officials to ensure that they tighten up that process around providing advice to businesses in these situations, including the advice they provide to staff. In relation to the health supports available to people in these facilities, there's a reminder that all people that enter managed isolation receive a health assessment on arrival, which covers both physical and mental well-being. Some people do require more health support, which is provided on a case-by-case basis as required. In relation to the incident in Hamilton, Air Commodore Webb gave details about that in his statement this morning, and I've been advised by the local medical officer of health that a second test from the swab taken this morning has also been found to be negative. I've also been informed that there were no other customers in the store when the person was there based on the CCTV footage. The Auckland experience highlighted that we needed to tighten up our responses to these situations, and I think the response in Hamilton shows that we have done that. And I do want to particularly thank Countdown and the liquor store owner in Hamilton for their responsiveness and their responsible response in this situation. Their actions have helped us to ensure that our team of 5 million will remain protected from COVID-19. A brief word on digital diaries. Having no cases of COVID-19 in the community does not mean that we can be complacent. We need everybody to be keeping a record of their movements. Downloading the COVID Tracer app and scanning codes is an easy way of keeping a secure record of your movements. The Ministry of Health is continuing to develop new features for future updates that will support contact tracing in response to feedback from New Zealanders. For example, one of the things that we know Kiwis want to be able to do is record visits to friends and whānau, and so there needs to be functionality to manually enter information like this where no QR code scanning is possible. We also need to support some older models of cell phones. Both of these issues will be addressed in the next update of the COVID Tracer app, which will be released by the end of this month. The Tracer app has now recorded 592,700 registrations. There are 77,459 posters with QR codes that have been printed, and 1,387,308 poster scans have taken place. The next update will be on those figures will be provided on Monday, the 13th of July. Happy to take your questions.
Communications occurred between Countdown and health officials, but last night the Ministry of Health wouldn't even say if they responded to those two emails from Countdown. What communications did occur? Or did they just receive those emails and not reply?
I think the response, the communication certainly happened. I think that they needed to be more prompt, so they needed to be in there quicker, talking to Countdown. And I think what you've seen from the Hamilton response is that that lesson has certainly been taken on board. We've now instituted some new processes which will be overseen by Air Commodore Webb, who will manage the immediate response to any such incidents, ensure that all of the other relevant agencies are notified, including the police and including health. They will then have coordination immediately to ensure that all of the relevant advice is supplied to anybody that needs it. And it will require a combined effort though, because if you look at, for example, reviewing CCTV footage, that requires the police to be involved in that process in order to be able to access that footage, but then health need to act on the findings of that footage. So that, I think, what happened with Countdown wasn't the level of response that we needed to see, needed to happen more quickly, needed to be more coordinated. Processes have been tightened up as a result of that, and you saw, as a result of the incident last night, a much faster and more coordinated response.
There with police looking at the CCTV footage on Tuesday night.
Look, I think if it is possible, look, it's difficult to speculate, but I certainly would like to have seen a more joined up and coordinated and faster response on Tuesday and on Wednesday morning. I'm now confident that new processes have now been implemented as a result of that experience. That means that any future events, our response will be much quicker.
What is your definition of communication, though? Because in terms of Derek's original question, is the Ministry of Health saying that they communicated because they received some emails, or do you have confirmation that they actually engaged with Countdown?
Well, that's the issue. Basically, in cases like this where speed is of the essence, where you need clear lines of communication, actually someone showing up at a business that has been affected, giving them good, clear advice, as has happened in the case in Hamilton, I think that will certainly provide a lot more reassurance to the community. Now, I want to say, and I do want to really acknowledge the business here in Hamilton. They continue to do all of the things that we have been asking businesses to do since COVID-19 started. So they have been continuing to regularly sanitise their store. They've still been using hand sanitizer. They've been doing all of the precautionary measures that we ask businesses to do anyway. And as a result, they were very, very well positioned for this.
Sorry to harp on about it, but you still haven't actually answered the question. Did the Ministry of Health actually respond to and provide any advice on Wednesday morning to Countdown, or has Countdown made every single decision off their own bat?
No, my understanding is that Health spoke to them, but it was later in the day. I've been very clear that that needs to be much faster.
Communication or advice given by the Ministry of Health up until it was completely closed on Wednesday?
I think, as I've said earlier, the Countdown experience highlighted that lines of communication here were not as clear and as quick as they needed to be in a situation like this, and that's now been tightened up. I think Countdown have worked very hard to do the right thing. They were not as well supported as they should have been, and I think that lesson has been taken on board.
Clarify then that the Ministry of Health then contacted Countdown after they'd closed their store, deep cleaned the premises, and off their own bat self-isolated 18 of their staff.
Yeah, look, my understanding is that the health communication with Countdown was certainly too late in the piece. Does not meet my expectations around the speed of response, and that message has been well understood by all of the relevant health officials.
Comfortable with the level of food and alcohol that people are being provided in these facilities? It seems to be the place that they're going when they're exiting these facilities. And in an interview too, someone mentioned they could give us more food, and also do you think that 4 bottles of beer is enough for a person stuck in isolation?
Look, hotels where they are serving alcohol have to adhere to host responsibility policies, and I'm not going to give them instructions about that. They have legal obligations in regard to that they need to follow. Ultimately, it is important that people adhere to moderate consumption of alcohol if they are in one of these facilities.
There's now to be a 24/7 police presence at all self-isolation, managed isolation facilities. Was that in place yesterday in Hamilton, and if it wasn't, would it have stopped this happening?
No, yes, it was. That was in place.
Where was that police officer?
Well, my understanding was that this person left through a fire exit and cut through a fence.
Wasn't the police supposed to be there from midnight, and this happened at 6 p.m?
My understanding was at the time it happened that I have been advised that there was a police officer on site at the time. Now, just to be clear here, though, these are not maximum security prisons. There is not a cordon around these facilities. There are fences, but they are hotels. And again, I just want to put this into context. Nearly 30,000 people have been through managed isolation and quarantine facilities since the COVID-19 response began, and we're talking about 3 cases here. The vast majority of people in these facilities are good, law-abiding people who are coming home, who are doing the right thing. I don't accept that people knowingly and willingly breaking the law necessarily represents a failure of the system. These are not prisons, these are hotels.
What do you say to the police union who said that cops are pretty much just babysitters?
No, I don't accept that. I think that we've all got a role to play here, and actually I've spoken to some police who are quite keen to do it because they want to be contributing to our collective efforts to keep the community safe. That's what they sign up for. One more, yes, Sarah.
Will they be wearing PPE gear or anything like that?
If they need PPE gear, they're certainly given it. There's a whole lot of things that are done for all of the people working in those facilities. PPE is one of the things that it's supplied, but also there are other precautionary measures that they can take, including physical distancing and so on. So they're given training on how to ensure that they're keeping safe whilst they're doing their jobs. That training's supplied to everybody who's working in those facilities, regardless of the role that they are undertaking.
Can I ask you about the privacy leak in regards to Michelle Vogue? Michael Woodhouse is saying that he told Todd Muller on Tuesday night that she had offered him some details regarding patients, and yet yesterday when One News was asking Todd Muller about this, he said he didn't know, and he basically said no, and that none of his other MPs had been offered this type of information. Was Todd Muller lying?
Look, that's a matter for Todd Muller and for the National Party. It is clear, however, that over the course of the last week, the National Party have had a lot of information that they have chosen not to share that could have cleared things up much more quickly. Over the weekend, both Mr Muller and Michael Woodhouse made some very strong comments about the release of this information and how unacceptable it was when it was clear that they knew how it had come to be released and chose not to share that information.
What does it say about Todd Muller's leadership?
Look, that's a matter for Todd Muller. But what I will say is that our focus is on responding to COVID-19. It is on doing everything we can to keep New Zealanders safe. Issues like this distract a lot of time and energy and focus away from that response at a time when we want everybody clearly focused on the most important issue of the day, which is to keep people safe from COVID-19.
What is the correct course to take if an MP gets such highly sensitive data?
Look, this is something that we encountered in opposition, and we did receive, in some cases, sensitive data, and you'll find examples of that where we went directly to the government before going public with any information about that to alert them to it. So my colleague Claire Curran became aware that there was a vulnerability in an IT system that meant that people's personal details were available. She reported that to the government, gave the government an opportunity to fix it, and then, after that was done, went public with the information. It's absolutely legitimate to call out if there has been a failure of, information handling. It is not legitimate to release that information or to sit on that information and not do anything about it.
On the Police Association is saying...
Look, again, I think the public of New Zealand and all of you will make your own judgments about that.
The Police Association is saying that putting police officers outside these hotels is going to take important resources away from road policing, domestic violence. What's your response to that?
I think keeping New Zealanders safe from COVID-19 is an important priority for all of us, including for the police. The police have done a remarkable job in recent months of helping with the collective COVID-19 effort, and I'm sure that they'll continue to do that. This is actually an important priority. The police's job is to keep New Zealanders safe. This is an area where we need their support to keep New Zealanders safe.
Takes police away from helping fix those important issues. Isn't that a pretty big risk?
Well, look, we're increasing the number of police that we've got on the streets. We'll keep doing that. But this, as I say, is a core part of the police's job, which is to keep New Zealanders safe. We need their help in this situation to do that. And the feedback that I've had from police that I've spoken to, including some retired police who have said they'll put their hand up to come back and help, is that they do think this is very, very important.
Leak, was it appropriate for the Ministry of Health to be sending a daily list of COVID-19 patients and their personal information to an email address linked to a political PR consultancy company?
Look, I think it's clear here that that was not being sent in that capacity, to that person in that capacity, but that is one of the things that the inquiry is looking at. I want to be very careful here about getting into the detail of what's going to be covered by an inquiry. I think it is important that the inquiry led by Michael Heron looks at who received the information, why they received the information, and whether that was appropriate. That is clearly part of the terms of reference of that inquiry, and I do want to see that inquiry completed through to its conclusion. I have not spoken, as I've said before, I have not spoken to him, and I don't intend to speak to him until his inquiry is complete.
The inquiry is underway.
emergency services still being sent a daily list or, daily spreadsheet of COVID-19 patients?
I've asked the Ministry of Health and all of the relevant agencies to look very closely at their distribution lists to consider whether they need to make any changes immediately, before the inquiry reports back. And then, of course, I expect that as a result of the inquiry, there'll be further recommendations that arrive from that.
Immediate changes being made?
Look, again, I'll certainly check that with health officials. I had that conversation with them yesterday, and I'll be following that up. It is important that they're always looking at, distribution lists. But having said that, and I do want to reiterate this, the organisation that it was sent to is a trusted emergency service. They will have people's private and confidential health information because of the nature of work that they do, and every New Zealander has a right to expect that they will treat that information with the utmost of confidence and with privacy squarely in mind.
What have health officials told you about why they dropped the ball in terms of testing numbers?
In terms of testing numbers, look, again, it's not clear. It's clear that the clinical guidance has played a role here, that there's, some of the GPs have pushed back against that. One of the issues was that even with the new clinical guidance, some GPs were continuing to report people to community-based assessment centres, and those community-based assessment centres weren't testing all of the people that they were referred to, that the GPs had referred to them. I think that's a matter of public record. Some people have made public criticisms about that. That's not okay. So the message has clearly gone back to those CBACs, community-based assessment centres, that if a GP refers someone to you, you make sure they get a test. We're tidying up that now. I do expect to see those numbers climbing again. Now, I just want to say something about testing. What I'm interested in is the overall averages across, a week or across a fortnight. Numbers do fluctuate on a day-to-day basis based on who presents. So, for example, slightly fewer yesterday than the day before. That will continue to happen. You'll still see unders and overs. We know from our experience right the way through from when we started testing, the numbers go down in the weekend. And so we'll expect to see a smaller number in the weekend, but we want to see the overall weekly averages coming back up again. Look, again, I think I went through this earlier in the week. I'm not going to second guess the clinical guidance, but one of the things I was concerned about is where a GP has made, in their view, a clinical judgment that someone should get a test. I don't want to see that then not followed through on, and there was evidence that that was happening. So I've made it very clear that shouldn't happen. If a GP says, in my clinical view, this person should get a test, then they should get a test.
Does the government have any specific policy around people with addiction issues in these isolation hotels?
Yes, additional support is available for them. So and some people will be presenting with drug or alcohol addiction issues, and there is support available for them, as there would be, if they were in a hospital or in any other kind of public facility.
Controlled amounts of the substances that they crave?
Look, again, that's something that the health officials will determine. For example, if someone's giving up on smoking, then they'll be provided with Nicorette or whatever the product is that they're using for that. People who have withdrawal issues from whatever the substances, there are ways that that health practitioners treat and support those people, and they can continue to do that whilst these people are in MIQ facilities.
And in terms of the amount of alcohol that you mentioned before, so 4 bottles of beer, right? Is that a government guidance or is that a hotel?
No, whatever restrictions on their alcohol, that is being made by the hosts, by the hotels, in accordance with their host responsibility policies. Now, every one of us who goes out for a drink will be familiar with these because they've all got their posters on the walls that says we will not serve drunk and intoxicated people, and they will make decisions about what an appropriate level of alcohol consumption is based on their host responsibility requirements.
People can get alcohol and groceries delivered, right? That's my understanding, that's allowed Uber Eats and Countdown and any other delivery company. So can you understand why exactly people are busting out of these hotels to go and get them themselves?
The advice that I have had as of earlier, literally an hour or so ago, is that people are not allowed in their deliveries to be having alcohol delivered to them as well. Now, I've asked for that to be double checked to make sure that that rule is being applied consistently. So I'll get further advice on that before the end of the day, I would expect. But they shouldn't be having extra alcohol delivered in addition to whatever they can obtain through the hotel that they're staying at.
Have you received health advice on how much someone with an addiction issue should, like how much alcohol they should get? Or are you just doing host responsibility? Because there are sort of two factors that play there.
So look, they are, yes, that's right, and they are treated as separate issues. So the issue is if, and bear in mind we're talking 30,000 odd New Zealanders who have been through these facilities. Someone asks for a glass of wine with their dinner or a couple of beers to have at the end of a stressful day of being in isolation. That's a matter for the hotel. If someone has a drug or alcohol addiction issue, then whatever the responses to that will be managed by their health practitioners, and whatever supply they get will ultimately be determined by their health practitioner.
Very costly to buy alcohol in a hotel, minibar prices and all. Are people able to access alcohol at an appropriate price for the families, ordinary people who are staying at these hotels?
Look, my understanding is that the hotels are working carefully to ensure that prices are reasonable in the circumstances. Yeah, but so they're not. My understanding is they're not charging what would be their typical, book rate for alcohol, which is well above what you'd pay if you were going to even to a bar or buying alcohol from a supermarket. So my understanding is that those establishments are charging a more reasonable rate. Bear in mind that is one of the only things that the people staying in them are being charged for.
Thank you, Minister. Was Woodhouse wrong to delete those 4 emails he received from Vogue?
I think if information that is sensitive and confidential is being supplied to a Member of Parliament, that Member of Parliament does have a responsibility to ensure that it is appropriately handled, and that if someone is doing something that is clearly wrong, then they've got a responsibility to do something about that.
Them earlier this week, though, when he was aware that the inquiry was happening. Was that wrong?
Look, Michael Woodhouse's moral judgments about what's right and wrong are really questions for him. But if you look at some of the public statements that he has made throughout this episode, they don't sound like the statements of somebody who knew where the information was coming from.
Have told the government that Michelle Vogue was shopping around this information, and has he let New Zealanders down on that?
Look, again, I'll draw the contrast with a couple of examples that I'm aware of when we were in opposition, where we were given information that was sensitive, where we made sure the government knew that that was happening so they could shut that down and then blew the whistle on it. That would be a responsible course of action to take. Look, I'll let New Zealanders make their own judgments on that. I'm not going to make judgments on behalf of the New Zealand public. They are more than capable of making their own judgments on this. Yeah.
Negative on day 3 and then positive on day 12. Does that mean that they caught it in the isolation facility?
No. One of the reasons we do the testing day 3 and day 12 is because of the incubation period. So, the testing regime has been carefully designed to allow for the fact that the incubation period can be up to 14 days. And so, it shows that the testing system that we've designed is the right one.
The HB Hamilton facility, had he recently been deported from Australia?
I haven't had that information, sorry.
Has he been tested?
Yes, he's been tested. He was tested twice, so negative both times. So the latest test was done this morning, I believe. The result is already in and it was negative.
Another test in case there's an incubation period?
Look, my understanding is that he is now in police custody. Of course, the health practitioners will make take all the appropriate precautions and determine what testing may be required there.
The Countdown and the man who visited Countdown who later tested positive, the 18 staff members who were there at the time, have they been tested?
They've certainly been offered testing, so it's been clear to them. Now, bearing in mind that there is a test on immediately after contact won't necessarily show anything, but testing is available to them. I don't know the answer to that. That's obviously a judgment for them and for the public health officials who are working with them to make.
There's been 3 escapes in little over a week, despite these border facilities being in place for months. What has changed in the last sort of 10 days or so, or has it just not been reported that there's been escapes before?
Look, one of the issues is that my understanding is the nature of the cohorts of people coming through those facilities has changed a bit. There are fewer families coming through now. There are more single people coming back. There are more people who have more complex health needs, which is one of the reasons why you've heard me talking about the additional health support that's available to those returning New Zealanders who need support with those complex health needs. But ultimately, let's put this into perspective. We're talking about 3 cases out of nearly 30,000 people going through these facilities in recent months. Again, I want to reiterate, the issue of language like escape and so on is these are not maximum security prisons. These are hotels. They are being supplied to New Zealanders to come home so that they can self-isolate and before returning back into the community. They can isolate, they can be cleared of having COVID before they come back into the community. And again, want to reiterate, other than the 3, people are following the rules. People are doing the right thing.
The deportees who've come back, do they have special guards looking after them, or do they just walk freely around the hotels?
Look, that's a question for Air Commodore Webb, but my understanding is that there is enhanced security arrangements for those who are being deported.
You mentioned police coming out of retirement just a few moments ago. Can you elaborate a bit more on that, and what areas might they be working in, and if there's how many have put their hands up?
Look, I haven't spoken to the police about that. These are just people who I have encountered in the last sort of 24 hours. And so, look, how the police staff that is clearly a matter for them.
Do you have a sense of why, all these questions around price and availability of alcohol, do you have a sense of why this guy in Hamilton cut a fence to get out, immediately went to a liquor store and came back within half an hour of his own accord? Was he not getting what he needed?
Look, I'm not going to make a clinical or medical judgment on that. That's something for the health practitioners concerned to deal with it, if that indeed is the issue.
Just a bigger picture question. Up until now, different departments have been doing scenario planning around COVID, and we've sort of seen this in the sort of economic side of things, where we say, if this is what happens, this is how the government will respond. If that's what happens, this will happen. Just wondering what the Ministry of Health's scenario planning is in terms of what if a vaccine is not found in the next few years, and what if COVID continues to sort of, spread wildly around the world. What does some of that scenario planning look like, and is that being done?
Yes, as you can imagine, that's a whole of government exercise, because it touches on every aspect of our economy and our society. So we are preparing for a whole variety of different scenarios there around when a vaccine might be available, how long borders might need to remain restricted for. All of those different scenarios, we're working our way through those, and what that means for all different aspects of government and the way we operate here in New Zealand.
Is there a scenario that ultimately in the sort of medium term we might need to just stop these border restrictions and accept that COVID is going to be with us, for years?
Look, again, we're working our way through a whole variety of different scenarios. I certainly hope we don't reach that point. I think we've done very well so far in keeping COVID-19 out of the country, and certainly we want to keep up that progress. And that's what the government is focused on at the moment. We, of course, are looking at a whole variety of different scenarios, into the medium to longer term, and we'll have conversations publicly about that in due course at the appropriate time. I don't have any announcements to make on that today, obviously.
Have you been updated on mental health following COVID?
Yeah, look, I've had some conversations about the level of mental health support that's available. As you'll be aware, even before COVID-19, we were doing some work to make mental health support more available through GPs and so on. And I'm getting regular updates about that, about what additional services are being supplied, how much of the money that's been allocated to that is being spent. There's a work program there to upskill the workforce to ensure that we've actually got the workforce we need in place. There are other aspects of this which we're working on. As Minister of Education, I'm doing work around the mental health impact for young people in schools and in early learning services, supplying additional support to schools and early learning services, tertiary education providers, and we've made announcements on that, and we've got more announcements to make on that around, ensuring that that level of support is available. Across government, there's a lot of people very stressed, working very hard. We've got the EAP, Employee Assistance Program, who are working hard to supply additional support to those people that that need it. This is a very multifaceted approach, as you can imagine. The mental health impacts of COVID-19 are extensive right the way across our economy and our society.
And if you had to sum it up, how is mental health of New Zealanders in this post-COVID world?
I think New Zealanders have shown a remarkable degree of resilience in an incredibly difficult time. It will have been more difficult for some than for others. And so for those where, it's added some additional mental health issues, then we want to be able to support that. And we're doing that through a whole variety of different ways. There are literally dozens, if not hundreds, of different things we're doing to support the overall well-being of New Zealanders as they struggle, as we all struggle, with the overall effects of COVID-19.
Looking at electronic bracelets at all for people in MIQ facilities?
Look, future arrangements around that, we're considering a whole variety of different options. And different monitoring arrangements are certainly one of the things that we'll be looking at. And I haven't got an announcement to make about that today, but I will say that we're looking at a variety of different options.
Being considered though?
We'll have further comments to make about that in due course.
All right. So, are you expecting more escape attempts, I guess, as the demographics of these returnees change, and what are you doing to plan for that if that's the case?
Look, like I said, we've done a lot, and Megan Woods and Air Commodore Webb have done a lot just to tighten arrangements around the managed isolation and quarantine facilities. Again, I'll keep coming back to it. Put it into perspective, we've had about 30,000 people through. We're talking about 3 cases, 3 individuals here who have acted irresponsibly. The vast majority of people coming through these facilities, even now, are still doing the right thing.
The ACT Party has suggested that returnees should be profiled for a risk of, escaping. Is that something you're also looking at?
But one of the things that we look at in the health assessments is where they have come from, and that's part of the profile that gets developed as part of the health assessments. Anyone leaving an MIQ, a managed isolation or quarantine facility, needs to have a health assessment done before they are given the all clear to leave. And all of these things get considered as part of that overall process.
But are you doing things like checking prior criminal convictions of people? And if not, is that something that you're looking to do?
Look, again, there's a whole lot of things that would go into that. Probably that's a question best addressed to Air Commodore Webb, who was looking in more detail, of course, at how we can continue to refine the processes in these facilities. Up the back, sorry.
So at least 3 English language schools have already shut down because students can't get here and the industry wants more support. What are you doing to help them?
Look, got a bit more to come for that sector. I do want to acknowledge that that's a really difficult situation for those English language schools. Unlike polytechs, universities and even schools, the people who are coming to study in English language schools often come on visitor visas, so it's the most restricted group of people at the moment, and that is a really tough, and they're often here for quite a short period of time as well. So life is very difficult for them. They are going to have a period of time where they will have to make adjustments as we go through a downturn. There will be additional government support available for them, and I'll have further announcements to make on that very soon. It will not preserve the status quo indefinitely. Some of them will have to make adjustments, but we will help them with that transition process.
Why haven't you sat down for a meeting with English language schools yet?
Look, I've been meeting with representatives from from all international education providers. English language schools were part of that meeting. I haven't met with each of them individually. As you can imagine, there are quite a few players in the international education space, from the universities, the PTEs, the English language schools, the polytechs, the schools, the secondary schools, the primary schools. And so I've tended to meet with them as a group rather than each individual part of them.
It's not because you're too busy because of your new health minister?
Whether I was Minister of Health or just Minister of Education, I would still probably be meeting with them as a group because it's an economical way of doing it. So,
current level of breaches, I should say, is acceptable?
Sorry, was that?
Do you think the current level of breaches at the border is acceptable?
Oh no, look, I don't want to see anyone leaving these facilities, and I'm asking everybody to follow the rules. I'd perhaps give you a bit of an analogy though. If someone broke into your house and stole all of your stuff and then turned around and said, well, you should have had better locks, I don't think anyone would accept that. These people are knowingly breaking the law, and as such they should be held accountable for their actions, and they will be.
A few weeks ago, Ashley Bloomfield and Megan Woods both said that they were looking at tighter room restrictions, maybe not letting people out until the result of their day 3 test came back. Is that still being considered?
That's a question for Dr. Woods and Air Commodore Webb. The Health are working very closely with the MIQ team. That sort of decision would be one for them. Health would obviously provide advice on that.
And looking for testing in terms of the apparatus that we need to perform tests.
At the moment, as of today, we could test 13,000 tests today if that number came through without any real difficulty. And one of the things, again, that I've been working on, I think I mentioned this earlier in the week, is just getting a better handle on the surge capacity. So if suddenly we found ourselves needing to do more than that, how long would it take to scale that up? Now, I haven't had that advice yet, because obviously there's a bit of work required to assemble all of that information, but I'm hoping to get that soon.
Getting the reagents and the apparatus into New Zealand, is that a secure supply chain given ongoing global trade disruptions?
Yes, and a lot of work has been done. There is a lot of global cooperation around this, as you can imagine. Particularly, there was a lot of debate about reagent. We all learned what reagent was earlier on in COVID-19. Those issues have been resolved. We've got enough supply in the country for weeks and weeks worth of testing, and the supply chains, as far as from what I have been told, are very secure, and there isn't a difficulty in getting more as we need it.
What's the average turnaround time for a test for people in self-isolation and a test for people in the general community?
24 hours. The vast majority of tests are processed overnight. Our MIQ facilities are all in areas where testing can be done overnight. There are some parts of the country where if you're in a far-flung part of the country, the transportation logistics might mean it might be 48 hours rather than 24 hours. But actually, where all the MIQ facilities are, it's 24 hours at the outside. And as you've seen today with the Hamilton case, where there's a real urgent need to speed that up, they were able to do that in a matter of hours.
Are you going to have another look at your alcohol policies if this man did indeed escape because he couldn't get the alcohol that he needed? Will you revisit it?
Look, again, as I've said, that's a matter for the hotels where there's a health-related need around, drug or alcohol addiction. That's a matter for the health professionals. I'm quite satisfied, based on the briefings that I have received, that that's actually being managed very well.
The Ministry was aiming to be able to contact trace 500 active cases by the end of June. Do you have any update on that?
My understanding, the most recent advice that I've had is that 350 per day could be done right now, that there is surge capacity there that can be stood up quickly to do at least an additional 500, and then with the right amount of notice period to scale up, they can get to 1,000 1,000 cases per day. At the moment, the contacts that can be contacted on a daily basis sits at around 10,000, and the surge capacity can, without too much difficulty, get that up to 20,000. So in the environment that we're in at the moment, that gives us all confidence that if we need to push the go button on that, that can be stood up and scaled up quite quickly.
Can you just clarify whether taxpayers are picking up any of the bill for people drinking alcohol in managed isolation, or are they paying for it themselves?
Yes, I can, and no, we aren't.
The Ministry of Health is managing that need.
Sorry, what's that?
Even when the Ministry of Health is managing that need.
Look, again, if someone can get support for drug or alcohol addiction through the health system, that's separate to any support that might be supplied through MIQ. So they can still get the same level of health support for a drug or alcohol addiction whilst they're in isolation or quarantine that they would get if they were not.
Do you know roughly how many people there are in managed isolation and quarantine who have drug and alcohol addiction issues?
No, I don't have a breakdown of that, sorry. All right, one last question.
If people keep absconding, will police presence be ramped up again?
Look, again, my message is to everybody in these facilities, and again, I want to say the vast majority of them are doing the right thing, is follow the rules. The rules are very clear. Follow the rules. Thanks very much. Look, that's a matter for Air Commodore Webb and Dr. Woods. Thanks.